Welcome to the Surgical Assistant Podcast, a podcast crafted by surgical assistants for surgical assistants, where professionalism meets passion. Hello, everyone, and welcome to the Surgical Assistant Podcast. We're here bringing you another great episode today. I'm Kelly, and as usual, I'm joined by John. Hello, John.
Hey, Kelly, how are you?
I'm good. How are you doing? And we have
Great.
our guest today for this interview and this what's going to be a information-filled podcast, I know. We have David Bartczak. He's joining us from Houston, Texas, or Southwest Houston. And David is the owner of Mederi Services. We're going to be talking about billing for surgical assistants today. David is a LSA and an orthopedic PA, so he's bringing a wealth of knowledge to us from the clinical side of things as well as the billing side of things. David, we welcome you and really appreciate your time today. How are you?
I'm good. Thank you, Kelly.
Good. All right. Well, we are going to jump in. And David, if you can just give us maybe a little bit of your background, just expound a little bit on your years of experience and how you came to be in the business that you're in as far as specializing in billing for first assistants.
Yeah. So I started in the medical field in surgery in the military. So I was a medic, and I did not like living in the woods. So I went to orthopedic school for the Army, and then we started in surgery there. And working at the Army hospitals, they didn't really track billing in the way that traditional practices do, but they taught us how to code and how to track patients. But then when I got out, that all became relevant because everyone was trying to figure out how do you bill, how do you do appeals. And the first surgeon that I worked for coming out of the Army had a hard time getting paid for my services. So I started a billing company back in 2008 to help other assistants, and while still working in the practice, kind of in that billing practice management role as well. So it started back in the military, just not taking no for an answer. To learn as much about tracking and reimbursement as we could.
Yeah, and it's amazing to me what you can learn the times that I've worked directly with a surgeon. I know I've been in the clinical medical field since I was 19. That's been a lot of years ago. But just working off and on for offices long term, when you pay attention and you pick the surgeon's brain and whether you're a medical assistant or a surgical assistant in the office, you can really glean a lot of information from how the surgeons do it and how their billing offices do it and those codes and there's all kinds of tricks, you as well as I do, that there are in and out tricks to coding and billing to get the most and work the insurance companies' games. And that's my words. That's how I put it. But they're obviously,
you just have to hang in longer than them for sure.
Yep. They're a business, and that's what it comes down to. They want to keep as much of their money as they can, and they have got the loopholes in place. So you're going to help us navigate today from the beginning. If we are going to have an audience, first assistants who are thinking about, hey, what does it mean to be an independent FA, and where do I need to start? And these are all the questions I'm going to have. You're going to help us navigate through that today. And John and I have come up with a list of good questions for you. And I know you get asked all the time and tagged on our Facebook groups. And so this episode is hopefully going to be a very valuable resource for our listeners. And I just want to tell you how much we appreciate your time again and lending us your brain and letting us pick your brain through this interview. So we're going to let John get started with some good pointed questions, and we'll just go from there.
Great. Thanks, Kelly. And David, thanks again for joining us. This information is invaluable. I've known you not personally, but we've communicated a few times, and I've seen you at conferences, and I saw you give a presentation on billing at one of the conferences, and I think it's information that's very desired out there. And I think a lot of people have a lot of misconceptions when it comes to billing. So I'm going to start out and ask you just a very basic question. Whatever your certification is, let's say you're an SA-C, you're a CSA, or you're a CSFA, can a surgical assistant bill independently no matter what state you're in?
The short answer is yes. The longer answer is there are a few states that have a very specific requirement for who is in the operating room, like New York and California. You have to have certain credentials to be there, and our normal surgical assistants aren't able to do that. New York actually has a pathway that you can get there, whereas California, it's basically a nurse or above that's there. The quick answer as well is if the surgeon has delegative authority in the state, then they can first assist in that state. It comes down to the hospitals as well. Some of them have a bylaw that only allows certain ones. Assisting in any state, I would say they can absolutely assist in any state. And the billing side of it they're two separate pieces of that puzzle.
All right. Thank you. So then how should a surgical assistant who's brand new to billing get started in understanding and navigating the billing process for their services? Because like you just said, pretty much any state, but then certain states have more caveats to it.
Yeah. So there's a bunch of resources that give you a general guideline. The first thing people have to remember is that there's the practice of surgical assisting, and then there's the business of it. So you have to be able to start a business. So the first thing I always tell everybody is start a business first. You have to have an NPI for your business that's different from your NPI as a person. And most states, again, it goes back to if you can work in the OR as a surgical assistant, you should be able to bill for that services. If they recognize you at least to do that, and you're not a surgical tech working in an elevated scope of practice, then you look at it as, can I work in that role first? Outside of should you be independent, you have to look at, there's a lot of factors that help play into whether you want to do it at that location. One of them being the state you're in you need commercial insurance, and you need good insurance that pays first assist. And so your state kind of matters. So you have to look at it. There's a very broad number of things that you have to look at, and that's in some of your other questions. But first thing is, can you run a business, and can you keep that business separate from the practice of surgical assisting? And then you get into the next part of the conversations after that.
Okay, great. Now, just the answer to that, those couple of questions shows me that this is a much broader topic than I had originally thought. And I know you offered to come back for a second interview, and I think that might be necessary because just the how much detail there is to get to understand. It's just not, can you bill? It's just not a yes or no question. There's so
Correct.
many nuances to it. So I appreciate you coming on and putting up with my ignorance. So let me just ask a very basic question then. What is an NPI number?
So the NPI number is a number that the government started to track healthcare professionals in what their role in healthcare is. So it attaches to a taxonomy number, which a taxonomy gives you kind of a category of what you are in the operating room. Okay. There's a lot of people who are employees that don't have one, and that's because it's really a billing thing or government tracking in the billing world. Your business has to have, it's a national provider identification number. Yeah. And you can look up any of us who are independent or any facility, and you can kind of see, like for me, it's PA surgical, and there is surgical assistant taxonomies. There are categories. The challenge is what you do in the operating room is not recognized in the same way that the insurance company looks at it. So the problem we had when it was created was it was bureaucrats and non-medical people that created a system to track medical people, and they don't understand what we do as surgical assistants. So there is the businesses are pretty simple. They have a surgery taxonomy code that goes along with your NPI number for the business time, but then picking the individual taxonomy code, everyone is issued an NPI number, but the NPI number is basically like having a social security number without telling them your name or your whether you're male or female. You have to have further identifying information to kind of break down what it is that you do in the medical world. And it's not necessarily what you're licensed for, which is why I said PA surgical, because it identifies what you're doing you're an assistant to the physician in the surgery space. Whereas we have a taxonomy that says certified surgical assistant, but that may not be your designation. Or they put things in categories, and categories aren't necessarily, the insurance companies don't get below the top category. So they put us in with surgical techs, because surgical techs work for the hospital, and the insurance companies and people who are non-medical think that the surgical tech is the one that's still helping the surgeon. And they're a part of that team, but they're not us. So there's a little bit more to how to pick that, but everyone who wants to be independent has to have one. Anyone who is in that role and responsibility should have one, because inevitably someone in the government is trying to track who's doing what, and it would be best to show how many people are really doing what we do.
Great. Thank you. The next question I would ask you then is, from your experience, what are the biggest challenges surgical assistants face when trying to bill independently for their intraoperative services?
The biggest challenge is probably making sure that they know the nuances of the insurance and that the case that they're doing. So some people do lots of hand and foot cases, or knee scopes, or very basic cases, and they think because you helped that somebody's going to pay you for that. And there's a couple of factors that play into billing. Is you have to have a payable insurance, and you have to have a payable procedure. And if those two don't line up, you don't get paid. So they have to understand at least the basics on that. And there's a bunch of guidelines that give you an idea, but ultimately is the insurance company gets to decide whether they agree with all the other data to whether you should be paid for that service.
All right. Thank you. And is it still realistically possible for a surgical assistant to bill independently and to make a successful living at it today?
Absolutely. Our company, we still have 350 clients. So somebody's making something, and we make a living on top of that. So the surgeons did 25, 30 years ago, and you can ask anyone who's still practicing, or the insurance company always figures out a way to pay less. Mm-hmm. So where 10 years ago, surgical assistants could do 5 cases a week and make a very good living because everybody had good insurance. Now, it's such a vast difference in insurance that you have to be willing to be busier. So if you think, oh, well, I work in the OR as an employee, I do 3 cases a day, I'm just going to go do that. That's not how independent billing works. If you're not able to get 40 billable cases a month, then you probably should stay employed. But again, it goes back to, what are your credentials? What's the insurance? Where are you at? And what kind of procedure are you doing? You just can't be an assistant. You have to look at the business side of it to know whether it's a viable path for you.
Okay. Kelly, is there anything you want to add at this point?
Yeah, I was just jumping ahead to make sure I wasn't going to cut into another question. I don't think I am. David,
Mhm.
just tagging on to that, is there a specific specialty that is better to work in as an assistant and bill for, where you have more successful reimbursement? Or is it better for a first assistant to be diverse in what the case spread that they're doing?
The general rule, I would say professionally, it's better to be diverse because
Mhm.
you don't want to turn down work. If you get pigeonholed into one thing, eventually the insurance company figures out how to not pay you for that one thing, and now you have nowhere to go.
Okay.
I
Yeah.
can give I so the short answer is spine and neuro, cancer related things. Um, those are all the best procedures. They're also the hardest ones. So that's probably why they still haven't figured out a way to stop paying for them. The worst ones, I would say right now, everybody loves C-sections and OB-GYN, but anything with like a single code to it is challenging now. And this goes back into the business thing. Everyone loves delivering babies. Everyone loves doing robotics, but it doesn't add value to the business side of it. And the insurance company, since the No Surprise Act started, has really cut back on reimbursements for those procedures. But whereas spine is a big one that is still has multiple codes, but they take a long time and they're very demanding, and you got to be willing to work harder to do those.
Yeah. I have a good friend that's been an assistant for 30 or 40 years, and she likes to reminisce about the days where she was doing assisting on C-sections and making a lot of money doing that. And so, like what you said, they just catch on and they stop paying it. So, okay, well that answers that question. That was a good answer.
Thanks. I'll move on and ask another question then. Let's see. Can you explain briefly, you don't have to go into too much depth, but the main differences between being employed independently, being an independent provider, I guess that would be a 1099 employee, or working for a surgeon's practice, or working for a hospital, like
Yes.
being employed as an employee in a hospital.
Yeah. So I think the biggest things people look at in that question is who's paying you.
Mm,
So if you're being employed by the hospital, they're just paying you to do it, just be there all day. So you might do one case. The 1099 aspect of it, working, you're basically contracting with the hospital and they're paying you for each case that you do. And then that's a really good way to do it, especially if you don't want to have to deal with insurance. You just do a contract with the hospital and say, okay, well, you're getting paid $300 for the first 2 hours and then $50 for each hour after that. The hospitals have made that a little bit more difficult because of the way that all the cybersecurity and all the weirdness of the way they have to treat their other contractors. We get kind of lumped into stuff that doesn't match because we're providers, not a contractor, but they have to figure out how to pay it as a business. And then working for the doctors, if you're getting paid direct from the doctors, sometimes that works as well. You come up with an agreed range and you say, okay, I'm going to come help you. And I'll bill your office $250. Fully independent means you only get what the patient or the insurance company is willing to pay you. I usually tell everybody now, and I've been telling everybody for a while, but now it's become a little bit more critical to have a hybrid type solution to all of
mhm.
this because there's so many insurances. We're the only ones who walk in the operating room and have no idea if we're going to get paid when we leave. So there's got to be some kind of agreement up front that someone's going to pay you. Can you bill the patient? Can you bill the facility? Is the doctor going to cover these type of insurances or these type of patients to make sure that you get something?
Thank you. Yeah, what I've heard, I've talked to a few people. I have a few friends that work independently, and they've told me that probably your best bet is to make an agreement where if the patient has good insurance, you bill the insurance, and the ones that have no insurance or you can't bill for their insurance, then you work out a deal with the hospital where, like you said, you get paid a stipend, whether it's an hourly rate or a per case rate. And that seems to keep them viable. But as you mentioned, it's only a matter of time before things change again in this business because
Yeah.
they just don't want to pay.
The hospital doesn't want to pay anybody. The patients don't want to pay anybody. The insurance companies don't want to pay anybody.
Right.
And the doctors want
Mhm.
to pay even less people. So
Right.
True.
everybody wants to work and they understand the value.
Mhm.
Problem is they don't understand the value till you're willing to remove yourself from that. And I think that's one of the questions you got in here too. So I'll leave that for
Mhm.
the question.
Oh, okay. Sure. Thank you. So how important would you say it is to understand medical billing codes and claim submissions for a surgical assistant that wants to get into billing for themselves? You just automatically recommend that they hire a billing company? That seems like it's probably the easiest and most successful way to do it.
Well, yeah, and there's not enough time in the day for
Mhm.
an assistant to make a living and build their own claims. Because you've got to have software, you've got to do appeals. Every phone call you get on now takes 30 to 45 minutes. That the insurance companies are purposely vague when they put things online for you to look at. So you have to get on the phone and then you're 45 minutes in on hold and then you get disconnected. So originally, when I started the company, it was going to be my claims and maybe a couple friends.
Mhm.
And I was going to just do it in my spare time. But there's just not enough hours in the day to do it. Um, I think that all assistants should understand the basics of coding. Everybody has Google. I can look up any code on Google. And what I generally do is I look it up and I find the same answer in multiple places. That way, I'm like, okay, I'm pretty confident that that's the answer. Uh, you know, you don't have to go to billing school. I didn't personally go to any billing schools. I did do some formal training, but that was in the military. Everything else has been self-taught. So to write appeals is very difficult, and it's almost required in 90% of the claims. So you've got to be able to do all of that. I don't think anyone should be trying to bill on their own unless
Mhm.
they have a family member or two, and then they're going to go do the work. I've seen people do it that had a family member in the background, and then it might be an option. But there's just too many variables to try to learn on your own. But basic billing is for the surgical assistant is just understanding the codes. Know that the case you're doing has this code. Sometimes it's written on the op reports. It's just memorization that a total knee replacement is 27447. Because then you understand if something comes back as a denial and it didn't have that code, you're like, well, there's the easy fix. Or if the doctor's office sends you the wrong code, then you kind of understand it. What I tell everybody is no one cares about your money more than you do.
Mhm.
If you don't have a basic knowledge, you shouldn't be sharpshooting your billers. You should definitely figure out if they're cut at it, but you have to understand enough to know that you're giving them everything you're supposed to do to be successful.
Yeah, and I want to piggyback off that, David, and say and just tell our listeners when you're in a case, and we've all been there when we're in a case in the hospital, and say we're doing a robotic, I don't say we're just doing a gallbladder, a robotic assisted cholecystectomy, and the patient has all these adhesions. So now we've got to take down these adhesions. If you'll notice, listeners, I'm not talking to you two, the surgeon is clarifying with the circulator and he's adding all these little things that he does. He's taken down adhesions. He's adding all these little side procedures because the coding process, from even the little I understand about it, is so complicated. I mean, there's modifiers you put on. There's a code for this procedure, but then there's a modifier you can add, and then you're lumping in different layering on different codes for added procedures, and you can just get bogged down in so much complexity that yeah, you should have at least a basic understanding of coding and how it works. But I would think before it would just help you as a first assistant to have a very fundamental understanding of how it works. But just knowing, having the expertise of someone that knows how to add in these codes and weave all these different things together to make it so that whether it makes the procedure more complex, and so now therefore a first assistant is required on the case and you're going to get paid. I mean, I don't even know how that works, but just cluing our listeners in that one of the reasons why we're so ticky in the operating room about adding all these little procedures as the case changes, one big reason they do it is for the surgeon's coding purposes.
Yeah.
And the hospital's coding purposes. Yeah.
And you have to know, like, if you did 4 procedures, 4 different things, you have to know that if they only give you one code, you need to understand, does that one code include all those 4 things, or are they leaving something off on purpose?
Right.
Because there's human error in all of it. And if they don't give you all the codes, you're missing out on money. So it's a check and balance going across the board from office billers. They're not always accurate. And then just everybody asking the right question to get the right answers.
Right. So there's a lot to it. It's definitely a complex issue.
Yes.
All right. That's great. So I think the next question you pretty much answered, which was going to be I think you would just say it's probably best to hire a billing company because sounds like there's so many landmines in trying to learn billing for yourself. If you're coming right out of the gate, that it's better to work with a company that's already navigated that minefield and knows how to do it. And unless you said, like, you're lucky enough, I did meet one surgical assistant whose wife did all his billing for him because that was her job. She was a biller before that, and now she just works for him. So I think, yeah, that's probably the best thing to do. Now, does geographic location matter for surgical assistants, and does it impact how they bill or get paid? Like certain states with licensure, let's say Illinois, Kentucky, Texas.
So, yes. So if everything's equal, being the procedures payable, insurance is payable, then they all get paid the same. They don't get paid more just because they're in Kentucky or Texas. They get paid more often. Okay. So Illinois has a law, and it's a single sentence inside of their surgical assist bill that basically says if they pay anyone, they have to pay them as well. Kentucky has something similar. Texas does not have that. So we can bill. In the law, it says we can bill, but it doesn't say anyone has to pay us. So geographic location is basically, do they have payable insurance? Going somewhere like Alaska, where they all have great insurance in Alaska because there's lots of money there with all the oil, they get paid very well. But somewhere like, I don't know, let's say Alabama, they're just terrible insurance. So if you understand the quick answer, if you understand the average annual income, the higher the average annual income for either the state or the region or the city that you're looking at, the better the insurance they have. So that's a very quick way to say, do I want to work there? If everything's being equal, none of that matters, but it's rarely all equal.
Okay.
Yeah, that's a great tip. And I would agree with that wholeheartedly, David. I lived in Alabama for 30 years. I became a first assistant while I was in Alabama, and very soon after that realized that was not a good state to be in as a first assistant. I mean, even as just an employee. So I moved to Florida specifically because of my career. And fortunately, my husband was at a point of retiring from the military. So we were able to make that move. And I'm not touting Florida as it's certainly not the end all be all, but it's much better than Alabama. And that's a whole other topic on how these insurance companies have such a stronghold in certain states and cause that issue that you just said, that you're just not going to make any money. And that is the truth. So I agree with you. That's a very good basic thing for someone to know, is what the demographic is, what the average median income is, and what is the insurance mix of the population where you work. Is it private? What percentage is private insurance and what is Medicare or Medicaid? So that's a very good point. And I just wanted to kind of emphasize that along with you to our listener. That's a very good thing to know based on where you are. And if you want to be independent, are you willing to relocate if you need to? That's something to ask yourself.
what people don't realize is that surgical assisting is not a job. It's a career. And everybody who's in a career needs to be willing to move to follow the career. If you just want a job, then go work anywhere. But if you want a career, you're going to have to follow where you can make the most money or have the most advantages or potential to make money.
It's a great way to put that. Yeah.
That is great. I'm so glad you said that, because that's my biggest pet peeve is this is a career. And I go one step further and say it's a calling, because it's not your 9 to 5 job. Sometimes you have to stay later. Sometimes there's nobody coming to relieve you and you've got to finish that case because it's for the good of the patient. So yeah, I'm so glad you said that. And I don't get along well with people who view it as just a 9 to 5 job and have no investment beyond that. So
Yeah.
let me ask my next question then. Are there any specific billing challenges or regulatory issues surgical assistants should be aware of when going independent? I know you mentioned the Surprise Billing Act.
Yeah. So that brings a whole different realm into it, as the No Surprise Act. I won't dive too much into that, except for to say that because the government has no idea who we are, I don't really feel that we're named specifically in the No Surprise Act, but that doesn't mean we shouldn't follow most of the rules and try to stay compliant. We've had multiple arguments with government agencies on this very subject, and we've won all of them, because every law, there is no law that you can just have a blanket statement of everyone in the operating room, say name people. And what we have to remember is some people call us assistant surgeons, but we're not assistant surgeons. That is very well defined as either in CMS eyes, it's a PA, nurse practitioner, or an actual MD. So, words matter in law. So be cautious when implementing things, but understand that if it doesn't say it in the law, just because someone's opinion says, well, it includes you. Like they used to say for years, you couldn't bill Medicare. It was illegal to bill Medicare. It's not illegal to bill Medicare. It's just, they're just not going to pay you. So the challenges that I think that people need to look for is, are you allowed to work in that state as that credential? And like I said at the beginning, if your state has delegated authority for the surgeon, then most likely you can work in that state as a surgical assistant. Now, billing is a different thing, because that's the business of surgical assisting. And it's just whether you can get paid or not. You can always bill. You can bill 100% of the time. It's up to the insurance company whether they're going to pay you. They have lots of rules where they say, we'll pay you, you just have to get in the system. But you won't let us in the system. Yeah, but just get in the system. Send us your stuff, we'll put you in the system. And that's their way of saying, well, we tried to get them paid, but they can't get in the system. They're not sending us what we need. So the government does that all the time. They don't say no. They just make it impossible to actually do. So I think that's the long version of your fairly quick question, but it's probably the most accurate of it.
Great. Thanks. Yeah, I know it's a short question, but it's not by any means a short answer to that question. I know there was a lot of factors involved, and thanks for making it understandable. So
David,
how do you... I'm sorry. Go right ahead, Kelly.
Do you need to keep that train of thought though?
No, go right ahead.
Okay. I was going to ask if any of the legislative advancements in certain states, as far as surgical first assistants, as far as registration and licensing in those states, has that had any impact on the billing process at all in those specific states?
A registration doesn't help much. We make the argument that we're like Colorado. We'll use them as an example. They got a registration, but that's because a surgical assistant killed somebody with drugs or did something or killed themselves. So they're like, oh, we need to know who these people are, which is kind of what happened in Texas. Somebody got injured, or somebody had a bad outcome in a surgery. And they're like, what do you mean you have somebody in there who's not licensed? So it's almost always a problem that creates it. But the legislators, again, they only look at the tracking or the regulation of a surgical assistant. They don't look at the payment of them. So registration in Colorado, they actually put it on a form that says license. And like
Okay.
registration in Illinois, it's a registered surgical assistant. It's not really a license, but it is. It's a license to them. The insurance company, it's all in the wording of the bill. And it's really easy to get a bill passed when you're not forcing hospitals to use you and you're not forcing insurance companies to pay you. So those are the two factors that you have to be very mindful of when writing these bills. They do help. Once they're done, the argument with the insurance company is, I am now registered and this is what they give us in our state. I'm recognized by the state. That's the terminology we use, because Blue Cross Blue Shield, for example, in every state requires you to be licensed or recognized by the state to be input into their system.
Okay.
So it does help. And we have to have a majority of the states that either recognize or license surgical assistants if we ever want to go to the national level of like trying to get Medicare to pay us. It has to be, I think they didn't even look at PAs until they had like 27 or 30 states that recognize them. So it's going to be the same challenge for us.
Okay. All right.
Okay.
Thank you. That answered that.
Great.
Well, thanks.
Yeah, and since you brought that up, that's another, because I've always heard people say it. Oh, well, I want licensure in my state because I want to bill insurance. So it doesn't necessarily help you, but it does. It will definitely. It won't hurt you if you have it. And,
Well,
or will it?
it can, because then it can limit your. So a license is about regulation. It has nothing to do with
Right.
in where they write it. So it can limit what you do. Like nurses are only allowed to do certain things. PAs are only allowed to do certain things. Surgical assistants, there's some gray area there because we're under delegated authority. We don't have a standardized state scope of practice. Now, the argument is you were never trained that, which is a good argument. You'll lose that every time if you don't have proof of training. But regulation inhibits your ability to do things. So, like in Texas, we're not allowed to technically close body cavities.
Okay.
Well, that's a total knee. That technically so on a total knee. So it limits what you do more than it helps you in some states, in some aspects of it. It all depends on why they're doing it.
That's great. Yeah, I've heard that mentioned before. I know I've talked to Greg Salmon about that. He's mentioned that, and he said that, well, he's now an attorney, so he said it ties your hands just as much as it helps you. But I mean, when surgical assistants talk about licensure, they're talking about it specifically so they can bill insurance for the billing aspect of it, not the regulatory aspect of it. And I don't think enough of them understand that. And that's why I'm so glad that you're here to talk about that, because I know I started my career as an assistant in Virginia when they had registration. And after I was registered for a year, the state of Virginia the state medical board sent me a letter asking me, how did you like your first year of being licensed? And I called them up immediately. I'm like, I'm not licensed. I'm only registered. And they said, oh, no, we view those as the same. To us, they're the same. They're synonymous. I was like, oh,
and
okay.
Yeah, to them it is, but not to the people who actually will pay you.
So it's a two-edged sword, so to speak.
Yes.
Yeah, definitely.
They're always, and they do it very specifically. They have a lot of money to spend on lobbyists, and they change one word and it gives them an out.
Always.
Okay.
So how do you see the future of surgical assisting billing evolving in the next 5 to 10 years?
I actually think that, so the No Surprise Act had one benefit. It allowed us to get paid more often, almost like we're in network, even though there's very few insurance companies that we can get in network with. So I feel like the next 5 or 10 years is probably going to push us to be able to get in network contracts more often. But then again, that's the same thing the doctors did 25, 30 years ago now. I keep forgetting how long I've been practicing. You have to do more. They used to make 65% of what they billed, and now they make 20% of what they bill. the prices haven't really changed ever. People who start practice, they never update their price. They just get paid less. So I think it will if we continue to get the recognition in the States, we've always tried to hide in the shadows because we were getting paid so much. And from the beginning, in 2009, you could probably find some of my articles. I told them, you have to be out in front of us. If you're not in their face showing them how important you are, they're gonna disclude you at some point. And so I think we can get a network more often. I think if we get more states that recognize us, we get, I think the combination of the organizations merging, I think that's a great thing. I've been saying that for 10 years. So I think it's all power in numbers. So the more that we get on the same page, the more likely we'll get some kind of pseudo recognition and payment from the insurance companies. I think we really need to be able to have the ability to get a network if we want. If they're going to offer us a fair price, then that's what we should be expecting over the next, I would say probably more like 10 years. But I don't know that much is going to change in the next 5 years in that respect. I think the current administration may actually help some of the roadblocks we have because they're a little bit more pro-health care provider than they are pro-insurance.
Okay.
Fantastic. And so what advice would you have for surgical assistants who want to transition from hospital employment to working independently and billing?
Do it as a hybrid. Start it as a part-time job. Know that if you can't run a business, don't do it. If you think you're going to work less, don't do it because you're not going to work less. After you get home from your 12-hour day, now you have to do the business side. It's not any easier. It's never been easy. We just had more money before. If you can't run a business, don't do it.
Okay.
That's my advice because it is, you have to separate the two and know that it's a business.
Right.
Excellent.
Yeah, I'm going to say it's good advice because that's been probably the biggest thing. And I don't call myself smart, but I'm smart in one thing and knowing that I can't run. Can't run a business. I know myself. So know yourself and what you're willing to do. And it's not easy peasy. Oh, I'll just go advertise myself. And even if you have good relationships and a good reputation in your area, that's not the most important thing here. You're right. I mean, you have to, also knowing the expectations and managing those expectations. But that was always a big one for me, John. I don't know about you, but anytime I thought about, do I want to go independent? I just knew, thankfully, from all my years of experience of working in offices and working with surgeons and alongside doctors and corresponding with insurance companies and billing companies even, I knew the background and it just overwhelmed me to think of all that muck that I was going to have to manage myself. It's doable. I mean, it's definitely doable. I think if you're a strong first assistant and you have a mind to do it, you can do it. But I love the hybrid idea, and that's exactly the advice I would give someone as well. Like go PRN or adjust your schedule in a way that you have time to commit to. And I think it's a different animal too, as far as you have to get, if you're going to work independent like that, and correct me if I'm wrong, you have to get credentialed independently with the facilities. Would that be true?
And some hospitals have bylaws that you can't work independently if you're an employee there too. So
right.
But then there are some that will do it almost like it's a contract. They'll let you bill your that you can bill, and if you think you can't bill, then they let you clock in. So it really just, if you make yourself invaluable, the hospital doesn't want you to leave, and they'll use you in that aspect of it. One of the things I was going to say too is if you kind of want to be pseudo independent, you can go work for a group. There's plenty of groups that are going to be better than a hospital will, and you can control your time a little bit more, which you don't worry so much about the business side of it. You still feel because you're going to different places, seeing different things, not the same monotonous schedule every day. So that if you just want the excitement of doing different cases, working with a good group can do that too. There's very few big groups left because of all the billing problems. If you can't get paid, doesn't matter how many cases you do. But there's ways to do it but if you want to be fully independent, it's a business. And if you can work your way into your part-time job becomes your full-time job, which is I think the way a lot of successful people have done it. You start with billing some days, and other days you still have money coming in, and then you work into the fully independent once you understand all the nuances of doing.
Yeah. So I think the further we get into this, I realize it's such a bigger topic than just one podcast. I think this could be maybe an ongoing series even, but
I would fully agree. I think we're only on like 10 of 30. I'm not opposed to committing some more time with you guys on these. I think
I appreciate that.
All of these are very important questions, and everyone asks the same ones. That's why I know the answer, is everyone has the same question, just nobody wants to answer it.
Right.
I gotcha. Yeah, and it seems like it like you said about running a business, because to me that means now to be successful you have to have a billing company, an attorney probably, and also an accountant, amongst other things. And I know nothing about stuff like that. I have friends that are independent. I wish I could do it. I would love that kind of lifestyle, but just to be able to work for myself and not have to be reliant on a hospital. But is there anything that we covered that you think we missed that you'd like to add, David, or like you said, the answers, because people ask you the same questions all the time. So is there anything else you'd like to bring up that we might have missed or not covered? Or
I guess in the same realm of the things that you have said and that we've already gone through, I think the business side of it is important. What I think people don't realize is the only thing you control in the business is you control your time. If they all want to control their own time, and like you had just mentioned, you get to control your time. But then what people quickly realize is the less you work, the less you make.
Mm-hmm.
So you find that you're not really controlling your time. You're spreading yourself out to the places you want to be. So maybe that time is more enjoyable. What I tell everybody too is if you're not working 5 days a week as an assistant, then go find another doctor and work 5 days a week, because it's and then you can back into, okay, well, these doctors I make the most money with, I'm going to commit myself to working with them. You can't have just one doctor, even if they're super busy. I don't know that some doctors don't have the same level of commitment to us as we may have to them. Make yourself invaluable. I said that earlier, and I can't emphasize that enough. If they're like, yeah, you can go on vacation, no problem, then you're not invaluable. I worked at a practice that it started out like that, like, yeah, go ahead. And then, I'm 2 days into a 7-day vacation and I get a call, and you got to cancel the rest of my week. I can't do these kind of cases. And then it was just do this kind of case the next time you're gone. And then it was, well, only do this kind of case the next time you're gone. And then it was, hey, when are you going to be gone? Because I'm just going to take vacation when you take vacation.
I love that.
Exactly.
If they can do it without you, then you're doing something wrong.
Right.
That's the way I look at it.
Yep.
I had a couple friends that covered for me on when I first went on vacations and stuff. And he was like, wow, how do you know so much stuff? I said, because I walked him through the whole procedure of what you wanted. So, if you're going to go to that level, to make sure you can't just send a body, because,
Right.
He tried that with the hospital, and the guy showed up late. And he's like, well, what are you doing? Oh, I'm scrubbing in. He's like, I'm already in here. You're already late. I don't need you now.
Oh boy.
And so you got to be, it's hard to find a group of co-op friends that think like you and will be on time. Like, I'm on vacation on the phone going, all right, he's leaving now. You need it. This is what you're going to need. Make sure they have this in the room. So you're still working even though you're gone, but you have to make sure that nobody can do it without you. You want to come back from your vacation with the hospital going, man, he was miserable. Or, hey, I was miserable. Why did you tell us this stuff? Because everybody knows that there's an OR table and this tray, but only you get to know what he's going to do when he's in there. So you have to, you want to teach everybody that too, because the definition of a successful surgery is nobody getting yelled at and no problems. And you are fully responsible for that and can make that happen if you're good at it. And they don't realize it till you're not there, which you have to not be there sometimes. Otherwise they don't realize what they're missing. But if you can do that part well, you'll be very successful whether you're independent or employed, because you want them to ask for you when you're employed. I don't sit around 8 hours in a day and do one case. I would be miserable. I have never been employed in a hospital, which is good. So, I just couldn't imagine doing so little in one day.
Right. Right. So yeah, if you're practicing like that, if you're employed right now, if your practice is like what you just described, where you're making that effort and you are that integral part of the team, that your team depends on you, your surgeon depends on you, and everything's going to go very smoothly because you've anticipated everything. You know your surgeon like the back of your hand, and then you're already setting yourself up for success to go into being an independent. So that's an important point as well. I mean, please be introspective and look at yourself. If you're lazy and you're hiding and you're trying to get out of doing cases right now, just mark independence off your list of things you want to do, because it's not the easy way out. And a lot of people have that misconception, I think, that, I'll be my own boss. I'll just ease into this and make a big paycheck and not do much. That's not the case, because you're not going to stay busy, buddy, if you have a horrible work ethic. So practicing those things in your daily work life is so important. And I'm so glad you said that the way you did, David. It's just what John and I preach all the time.
And knowing that I think what a lot of people feel like also, and I said this at the beginning, I believe, is they feel like, I did the case, how come I'm not getting paid? They have to know that in our world, you don't get paid on every case.
Right.
And you're going to have to do something for free.
Or you may get paid very little. It's like, that took me 2 hours. I got paid $67. What? At some points, I've joked and been like, I can sit at home for less than that. You don't go in for free cases. If you're independent, if no one's going to pay you, you have to be a business person. Go, look, if no one's going to pay me for this, but then you have to know that somebody may come behind you, go, I'll do all your cases and that one. So you've got to do some of the charitable stuff, but not so much that you can't make a living, but yet you're working 60 hours a week.
Right.
Yeah. Don't do free work, but all of that kind of, like you said, is it all builds to where they won't do it without you. So you have the ability to name some of your terms. So you might have to do some of the grunt work at the beginning,
right,
to make yourself, to show your worth and make yourself invaluable. But then at some point you gotta be able to run the business, because I know lots of people who they come out and they're like, I'm doing 60 cases a month. Like, all right, you're going to do well. And then you get their 60 cases and they're like, well, none of these are billable. You can't.
Wow.
So normally our questions in the billing company world, and I hope we go through and do a couple of these, because I think there's different aspects of this, but in the billing world, one of the first things I ask people is, okay, well, what kind of cases are you doing? I don't care on the numbers. What kind of cases, and do you have any idea what the insurance is? Oh, I don't know. I tell everybody, if you're working in the OR already and you're trying to figure out if you want to work in that OR, look at the insurance work or paperwork on, 2 weeks of work, of work.
Yep.
You'll get a really good idea of what. Yep. You don't have to take any HIPAA data. All you need to know is what the insurance policy is. So it's the business part. You have to do some research. There's glory to being the independent guy and everybody wants you, but that glory doesn't pay the electric bill. So you gotta look at it differently. There's, like I said, there's a lot more that we could do today and get through.
Yeah, we're going to save it because this is excellent.
Oh,
Because
yeah.
I see where this is going, and we're going to
Mhm.
be able to get into so many specifics. And if you're willing to give us that time, we are willing
Yeah,
to
we can definitely
take
make
it
it
because
a
it's just
ongoing
so
series.
helpful. Yeah.
Yeah, no, I think we can definitely schedule some more time for this.
That's
Okay.
great, David. I
All
appreciate it. Do you want
right.
to, before we sign off, do you want to just mention your company a little bit and how people can get in touch with you?
Yeah, so my company's Mederi Services. We specialize in surgical billing. We're probably, if not the largest, one of the largest in the country that specializes in surgical billing. There's lots of big billing companies, but not everyone does this. I am and always have been a surgical assistant. I worked in the practice, so I understand the billing side, the business side. And so having someone that owns a billing company that understands exactly what the questions and the answers are before you ask them, I think is invaluable. To get a hold of us, if you look us up online, we have a pretty decent presence. But if you go to our website, you can either contact us through there, or if you guys want to give out my number, I'm okay with that as well. They can either call me or contact the company, or we have a live chat that we do during the day, so they can ask questions. When I tell everybody, there are a lot of billing companies out there. There's just not a lot of them that do it well. There are,
Mm.
True.
and everybody can do it well for a short time.
Mm.
You have to find the ones that can do it for the long term, because
And it will make or break your business in
it will.
this, having a good billing.
It means everything. If everyone's overpromising, then that's the first sign they're probably not the right ones. The ones who aren't going to tell you the hard truth is probably the wrong ones. And when the doctor's billing that, the doctor's offices don't know how to bill for surgical assistants. They don't know how to do appeals. They're only worried about the doctor's money. So we
Mhm.
see a lot of that. But I'm on all the social media stuff, and if anyone wants to reach out to me directly with questions or whatever, you guys are welcome to give my number out or my email or whatever.
Yeah, John will post a
Thank you.
link.
I'll put that. Yeah, I'll put that in
Website
the
link, whatever, yeah.
description.
And
Um,
I definitely want to do more of these with you guys. We can get through all of these questions and probably come up with some more
Oh, yeah.
in an ongoing series.
Oh, definitely, because I've already got a bunch more just from answering these questions. But I can only say my personal experience is I saw you at a conference and it was mind blowing. And the more people I talk to, you've got a reputation in the community of having a great company. In fact, a friend of mine who's a surgical assistant told me that he switched to your company and his revenue went up 25%.
Yeah.
So
Nice.
Well, sometimes it's just about caring whether people get paid. You know,
that's just it.
we understand what it means to get reimbursed. So if we care whether you get paid or not, that makes a difference. Like I said, there's a lot of companies that do it. There's just not a lot of them that do it well anymore. And we fix major problems all the time. And we're like, well, why did you go to them? Well, they told me this. I'm like, well, okay. Well, here's what you have to do to fix it now.
Yeah.
So just do your research, be comfortable with who you're working with. Most people, if you ask for references, they're not going to give you somebody who hates them. So you've got to feel comfortable with them. I don't think references really help anyone because, it's not for a reference. I would never give you somebody who hated it. So you just got to make sure you ask the right questions and feel comfortable with what you're doing and pay attention. If they're not transparent in what they're doing all the time with reporting and notes and be willing to explain things to you, then it's probably the wrong company too.
Yeah. Okay.
Fantastic. Well, thank you so much, David. I really appreciate it. And
All right.
tune in. Stay tuned for further segments with David. I appreciate that. Thank you.
All right. Bye, everybody. Thanks for listening today. We invite you to like and subscribe to this channel and leave a comment if you'd like. Feel free to look us up on Facebook at the Surgical Assistant Podcast or email us at thesurgicalassistantpodcast@gmail.com. Until next time, content of this podcast is in no way intended for diagnosing or treating surgical conditions. No patient-specific information is shared. All HIPAA guidelines will be adhered to.